How to prevent cancer. Home filtered tap water is a safer better than bottled water, whose quality often is not higher and in some cases is worse than that of municipal sources, according to a study by the Environmental Working Group. Store water in stainless steel or glass to avoid chemical contaminants such as BPA that can leach from plastic bottles. Stop topping your tank. So say the EPA and the President's Cancer Panel. Pumping one last squirt of gas into your car after the nozzle clicks off can spill fuel and foil the pump's vapor recovery system, designed to keep toxic chemicals such as cancer-causing benzene out of the air, where they can come in contact with your skin or get into your lungs. Marinate meat first. Processed, charred, and well-done meats can contain cancer-causing heterocyclic amines, which form when meat is seared at high temperatures, and polycyclic aromatic hydrocarbons, which get into food when it's charcoal broiled. The antioxidant-rich spices can cut HCAs by as much as 87%, according to research at Kansas State University. Caffeinate every day. Java lovers who drank 5 or more cups of caffeinated coffee a day had a 40% decreased risk of brain cancer, compared with people who drank the least, in a 2010 British study. A 5-cup-a-day coffee habit reduces risks of oral and throat cancer almost as much. Researchers credit the caffeine decaf had no comparable effect. But coffee was a more potent protector against these cancers than tea, which the British researchers said also offered protection against brain cancer. Water down your risk. Drinking plenty of water and other liquids may reduce the risk of bladder cancer by diluting the concentration of cancer-causing agents in urine and helping to flush them through the bladder faster. Drink at least 8 cups of liquid a day, suggests the American Cancer Society. Load up on green greens. Next time you're choosing salad fixings, reach for the darkest varieties. The chlorophyll that gives them their color is loaded with magnesium, which some large studies have found lowers the risk of colon cancer in women. Just half cup of cooked spinach provides 75 milligrams of magnesium, 20% of the daily value. Snack on Brazil nuts. They're a stellar source of selenium, an antioxidant that lowers the risk of bladder cancer in women, according to research from Dartmouth Medical School. Other studies have found that people with high blood levels of selenium have lower rates of dying of lung cancer and colorectal cancer. Researchers think selenium not only protects cells from free radical damage but also may enhance immune function and suppress formation of blood vessels that nourish tumors. Burn off your risk. Moderate exercise such as brisk walking 2 hours a week cuts risk of breast cancer 18%. Regular workouts may lower your risks by helping you burn fat, which otherwise produces its own estrogen, a known contributor to breast cancer. Skip the dry cleaner. A solvent known as perchloroethylene that's used in traditional dry cleaning may cause liver and kidney cancers and leukemia, according to an EPA finding backed in early 2010 by the National Academies of Science. The main dangers are to workers who handle chemicals or treated clothes using older machines, although experts have not concluded that consumers are also at increased cancer risk. Less toxic alternatives: hand wash clothes with mild soap and air dry them, spot cleaning if necessary with white vinegar. Ask about breast density. Women whose mammograms have revealed breast density readings of 75% or more have a breast cancer risk 4 to 5 times higher than that of women with low density scores, according to recent research. One theory is that denser breasts result from higher levels of estrogen, making exercise particularly important. Head off cell phone risks. Use your cell phone only for short calls or texts, or use a hands-free device that keeps the phone, and the radio frequency energy it emits, away from your head. The point is more to preempt any risk than to protect against a proven danger. Evidence that cell phones increase brain cancer risk is neither consistent nor conclusive, says the President's Cancer Panel report. Block cancer with color. Choosing your outdoor outfit wisely may help protect against skin cancer, say Spanish scientists. In their research, blue and red fabrics offered significantly better protection against the sun's UV rays than white and yellow ones did. Don't forget to put on a hat. Though melanoma can appear anywhere on the body, it's more common in areas the sun hits, and researchers at the University of North Carolina at Chapel Hill have found that people with melanomas on the scalp or neck die at almost twice the rate of people with the cancer on other areas of the body. Pick a doc with a past experience, lots of it, is critical when it comes to accurately reading mammograms. A study from the University of California, San Francisco, found that doctors with at least 25 years' experience were more accurate at interpreting images and less likely to give false positives. Ask about your radiologist's track record. If she is freshly minted or doesn't check a high volume of mammograms, get a second read from someone with more mileage. Eat clean foods. The President's Cancer Panel recommends buying meat free of antibiotics and added hormones, which are suspected of causing endocrine problems, including cancer. The report also advises that you purchase produce grown without pesticides and wash conventionally grown food thoroughly to remove residues. At least 40 known carcinogens are found in pesticides, and we should absolutely try to reduce exposure, Sellers says. Do a folic acid check. The B vitamin, essential for women who may become more pregnant to prevent birth defects, is a double-edged sword when it comes to cancer risk. Consuming too much of the synthetic form has been linked to increased colon cancer risk, as well as higher lung cancer and prostate cancer risks. Rethink your multivitamin, especially if you eat a lot of cereal and fortified foods. A CDC study discovered that half of supplement users who took supplements with more than 400 mcg of folic acid exceeded 1000 mcg per day of folic acid. Most supplements pack 400 mcg. Individual supplements may be a smarter choice for most women who aren't thinking of having kids. Up your calcium intake. Milk's main claim to fame may also help protect you from colon cancer. Those who took calcium faithfully for 4 years had a 36% reduction in the development of new precancerous colon polyps 5 years after the study had ended, revealed Dartmouth Medical School researchers. Though the study was not on milk itself, you can get the same amount of calcium in 3 8-ounce glasses of fat-free milk, along with an 8-ounce serving of yogurt or a 2 to 3 ounce serving of low-fat cheese daily. Commit to whole grains. You know whole wheat is better for you than white bread. Here's more proof why you should switch once and for all. If you eat a lot of things with a high glycemic load, a measurement of how quickly food raises your blood sugar, you may run a higher risk of colorectal cancer than women who eat low glycemic load foods, found a Harvard Medical School study involving 38,000 women. The problem eats are mostly white bread, pasta, potatoes, and sugary pastries. The low glycemic load stuff comes with fiber. Pay attention to pain. If you're experiencing a bloated belly, pelvic pain, and an urgent need to urinate, see your doctor. These symptoms may signal ovarian cancer, particularly if they're severe and frequent. Women and physicians often ignore these symptoms, and that's the very reason that this disease can be deadly. When caught early, before cancer has spread outside the ovary, the relative 5-year survival rate for ovarian cancer is a jaw-dropping 90 to 95%. Avoid unnecessary scans. CT scans are a great diagnostic tool, but they deliver much more radiation than X-rays and may be overused, says Barton Kamen, MD, PhD, Chief Medical Officer for the Leukemia and Lymphoma Society. In fact, researchers suggest that 1/3 of CT scans could be unnecessary. High doses of radiation can trigger leukemia, so make sure scans are not repeated if you see multiple doctors, and ask if another test, such as an ultrasound or MRI, could substitute. Drop 10 pounds. Being overweight or obese accounts for 20% of all cancer deaths among women and 14% among men, notes the American Cancer Society. Plus, losing excess pounds reduces the body's production of female hormones, which may protect against breast cancer, endometrial cancer, and ovarian cancer. Even if you're not technically overweight, gaining just 10 pounds after the age of 30 increases your risk of developing breast, pancreatic, and cervical, among other cancers.